My name is Kaitlin Jeffrey, and I was brought to the burn center in December after a fire broke out at a fraternity party. A fire was ignited by a torch having rubbing alcohol poured on it, and I had caught fire to my hair and face and was brought to London Victoria Hospital, later then transferred to Hamilton Health Sciences.
It was very obvious that her burns to her face and her neck, as well as hands and back, were very deep. And we do know that we can do great skin grafts, but a skin graft will always have long-term effects, meaning scarring. So when I looked at that and I tried to, at any cost, avoid to do a skin graft to her face and her neck. We, in our Center for Burn Research, have been studying skin printing and stem cells and skin replacements and interventions to induce wound healing and regeneration. So one of the products we use besides stem cells is the products of stem cells, which is exosomes. I call it these little fat bubbles. These are products from our cells that we produce, and all of our cells produce these exosomes. So basically they're very safe, they're very effective, and again, they're novel. So we felt because they are safe, we can use the exosomes. We had some good evidence on our research that it is highly effective. So we were being the first in the world, but we estimated that it will be or can be effective. We were just very surprised to what extent it was effective. We did the exosome treatment in the operating room. So we did standard debridement of burns to the face and the neck. We did the grafting of wherever we needed to, not the face and the neck. And we injected exosomes. She got, actually, to give you an idea, in the 2 operations, she got 1 trillion exosomes. The neck was so deeply burned that it was 100% guaranteed that she needed grafts. But again, even with this exosome treatment, we were able not to graft it, got it to heal. The activity of the scar, the redness there, is the result of the depth of the burn. But we work on this to also make it better.
I had thought that my face was gonna look the way it did for the rest of my life. But pretty much right after I got out of the treatment, the difference from before and after, even though there was still blood from the debridement, was night and day, and just every day it got better and better.
What was remarkable about HHS is it's the translation from discovery to impact, not only nationally, but even would say globally, because somebody benefiting from discovery to impact that quickly is just very unique. So my vision for it is to use it as a biologic treatment for patients who would be qualified, right? We saw the massive change of our treatment within a short period of time, and I think this will be an indication for exosomes. Even in the acute phase, like an initial treatment saying, this patient will benefit from it, it can prevent the conversion to deeper burns and cause, as we now know, an amazing result in terms of preventing scarring.
I'm just so grateful for all of the staff because my experience and the way everything played out wouldn't have been the same without them. And I don't think I honestly would have been able to do it without the care of all the staff here.